State's health care managers met today to discuss COVID in Idaho. Today, hospitalizations, case counts, the FDA approval of the Pfizer vaccine, just a few of the key topics discussed. Our Shira Matsuzawa was on that call and joins us now with some of the key takeaways. Shira?
Well, Mark, that call started off with some good news. Director Dave Jepsen said vaccinations in Idaho continue to increase. In fact, among those 65 and older, our state data shows we're now getting very close to 80% for the first dose. Among those 12 and older, it's 53%. But those vaccination numbers come as the state healthcare leaders say they're very concerned about what's happening in our hospitals.
The question is, how close are we to hospital capacity? I would say we are over hospital capacity right now.
Idaho Department of Health and Welfare Director Dave Jepsen painting a picture of what our healthcare systems look like across the state.
Probably most concerning is the number of COVID patients in the hospital. We are actually near, just below our previous peak in December for number of patients in the hospital with COVID. And very concerning is that the number of patients in the ICU with COVID-19 is now the highest it's ever been across the state at any point during the pandemic.
The vast majority are unvaccinated individuals. During Tuesday's COVID-19 media briefing, Jepsen shared how he visited one of the ICUs in the Treasure Valley over the weekend.
It's really hard to describe the amount of sadness and suffering that's occurring there. The ICU unit was full of COVID-19 patients that were all struggling, many for their lives, and it was very, very challenging for them and their families, and also on the medical staff.
He says our hospitals are full and stressed.
We are dangerously close to crisis standards of care,
which means hospitals would begin rationing care. He says the answer is getting the COVID-19 vaccine.
Our statewide low for cases per 100,000 was just about 6 weeks ago on July 5th at 3.3, and today we're at over 30, so we've increased tenfold in our case rate across the state.
As kids return or get ready to go back to school, Idaho Health and Welfare says the department will make $30 million for COVID testing available for K-12 schools that sign up for the funding in the next couple of weeks. That funding comes with minimal reporting requirements.
We do not want to get in the way of the program. So we'll definitely want to know how many tests they conducted, and we'll want to know, what their costs were. But the actual reporting of results is up to the person generating the test.
As for COVID data for schools in Idaho not receiving the funding, Dr. Catherine Turner says there was no formal mechanism last year for how that was done.
We do our best by working with the public health districts, trying to work with the schools, lurking on their websites to see what they're publishing to pull together some sort of statewide picture. And we're looking at whether or not there's a better way to do that this year, because
also
it's super
slow
time-intensive,
aerosol transmission.
manual, and not necessarily comparable from school to school.
Right, and with hospitals full, Idaho Health and Welfare says they are looking for volunteers from the public to help with anything from housekeeping to medical staff. And if you'd like to volunteer, you can sign up at volunteeridaho.com. Mark?
Boy, that soundbite of Dave Jepsen talking about his experience going through the ICU paints a dire picture, doesn't he?
Absolutely, and I think that's what a lot of people are experiencing, right?
Right. All right, Shira, thank you.